Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about a really important muscle in terms of isolating the glute max muscle, making sure we're not arching through the lower back, and reducing the use of the hamstring muscle. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I have here up on my channel. So today I want to show you an exercise called the prone knee extension exercise. And in a lot of cases, what we're trying to do here is we're trying to isolate and utilize the glute max muscle appropriately and extend through the hip appropriately. And this is one position and movement that I'll see is frequently not done correctly and can lead to overuse, excessive use of the hamstring muscle. You can see some shearing or movement through the lower back. And biomechanically, it's one of those movements that a lot of people tend to do wrong and can create all sorts of different issues, again, in through the hip, in through the lower back. And so we really want to try to make sure we're doing this position, this movement correctly. So essentially what we're going to do is I'm going to go on your stomach like this. Okay. And then the movement, right, you're going to bend one leg here. And the idea is I'm going to do some hip extension. So essentially I'm extending through my hip here. This is where the movement wants to take place, right? And so I'm contracting, I'm going to squeeze, contract my glutes. I'm engaging my abdominals slightly to minimize lower back movement, and I'm lifting the leg up. And so I'm really feeling my buttock muscle, my glute muscle contracting, right, as I do this movement. Now, what we want to be careful with, and this is what I'll see a lot of times where people are perhaps not doing this correctly, is there'll be an extension through, right, the lower back. There might be an overuse of hamstrings. So basically the glute muscle isn't working correctly. If there's tightness in through the quadricep muscle, there might be some shearing rotation movement through the lower back, right, as they lift. So there might be some rotation, right, that occurs. And again, the key is, right, the key is to minimize movement in these other areas and to just extend through the hip. And again, this can be very, very difficult for patients to do. If there's, for example, an overuse of muscles in through the front of the pelvis, a tightness, a restriction through there, a restriction in terms of hip extension. So again, there might be an overcompensation, overextension through the lower back. So really important to do this correctly. The last thing with that exercise, it might be helpful to put a pillow, and I don't have one here right now, but a pillow under the pelvis to, again, keep that lower back neutral when doing the exercise. Please make sure to check with a physiotherapist to make sure that this exercise is appropriate for you. And please feel free to leave a comment below. Thanks again for watching and have a great day. Take care.